Again, as mentioned, I'd like to thank all of our panelists for the time today to take out and really touch upon an important topic. Of all years, this year has been definitely very unique. It's brought a spotlight onto healthcare at large, diagnosis, treatments, definitely the vaccine. But as the year has progressed and all of us had to deal with the different dynamics, the work from home, the stresses of potential lockdowns, the uncertainties, the anxiety around just being worried for healthcare, there's been a noticeable and significant impact on mental health and wellness. Touching upon that topic, we have our panel today. We have Dr. Prem Pillay, who is a medical director, neurosurgeon. He is also a medical innovator and futurist, along with the CMO of Pureland Group. We have Nav Vij, co-founder and CEO at Cognifyx. Effie Wang, senior psychologist at Cognifyx Psychology Clinic. Chad Yip, head psychologist at Cognifyx Psychology Clinic. And Angeline Teo, GM Asia at Firefly Entertainment AB and investor advisor at Fairphonic. The panel today really has a wealth of experience across the mental health and wellness space. So without further ado, let me pass it to Dr. Prem, who will be taking the session forward, and to our panelists to better introduce themselves and the tremendous work they're doing. So thank you for everything that you are doing, and we really look forward to this kind of insight and a topic that's traditionally been taboo in Asia, but bringing light to it. So thank you again, and the floor is yours.
Thank you, Varun. It's great to have this opportunity to speak on mental health. Mental health, as has been alluded to, particularly in Asia, is almost like a taboo topic. But global research has shown the greatest cause of disability, healthcare disability in the world is a mental health issue, which is depression. Almost 60% of people globally are going to experience some form of depression throughout their lives. And most people who are of working age, it's at the workplace that mental health issues are now being recognized, not only by the employer, but obviously because of its impact on the employee. So I'm going to get every one of the panel to give a short synopsis of what they're doing in mental health. My own role is that I'm a neurosurgeon and neuroscientist. I was a director of the Singapore General Hospital's Brain Center, which is now the National Neuroscience Institute. I'm currently medical director of the Singapore Brain Spine Nerve Center. So we see a whole lot of people with brain health problems. And what we notice is that mental health can make physical illness worse. So I'm going to ask Effie Wang, senior psychologist at Cognifyx. What are your viewpoints on mental health, Effie?
Hi, thank you, Dr. Prem, and hi, everyone. Yes, I was actually recently being invited to do quite a few talks to address mental health issues, especially in workplace. And when I was doing research, just to add on to what Dr. Prem was saying, is that actually the recent study looking into the stress during circuit break time, people actually, there's actually more people feeling stressed than frontline workers while they're working at home. So it was very interesting. And my role in mental health is mostly involved in providing training and provide psychoeducation for people to have better understanding of psychology, understanding why they feel the way they do, and how they can manage their emotion and to get better well-being.
So I think I will ask Nav from Cognifyx. He's the CEO and co-founder. Nav, what are your thoughts on mental health? I think you're muted, Nav.
Yeah.
Okay.
Thanks again for the introduction, and good afternoon to everyone here. I think before I have lots of thoughts on mental health. Maybe before I share, I'd just like to very quickly introduce Cognifyx and what we do. Okay. So we are a deep neuroscience company. We have a proprietary neuroscience platform, and this allows us to specialize in neurometrics and psychometrics. Okay, now, why is this important? This allows us to look very deeply into brain health and mental health issues in corporations and organizations. When we look at mental health as a priority for us, so we use latest digital tools. We have a digital brain scan so that we can more objectively assess mental health within teams and employees and companies. So I'd like to share that within this sort of COVID period and a pandemic that's happened very recently, mental health has become towards the forefront. A lot of corporations, a lot of employers, and I think with a lot of employees also. We're looking at new, innovative, and scalable ways at understanding our own state of mind, our mental health, as we try to progress and improve our mental health journey, improve our brain health journey. And I see this happening a lot more within corporates and within the corporate sector.
Very good. Chad, I have a question for you because I'd like to get your viewpoints, but isn't it true that some people don't even know they have a mental health issue? I mean, everyone has mental health. We hope it's good mental health. But when do you know that there is an issue with your mental health? What are the symptoms people should be aware about?
Yes, that's a really, really interesting question. Just picking up on what you mentioned earlier, I think mental health in Asia is really still a taboo. As you know, in Singapore, even though we are very medically advanced, we are still lagging behind many years, as compared to Australia and New Zealand, for example, in terms of mental health. Just briefly touch on a bit of our own experiences. I have a privilege, to work in Australia and New Zealand, for 14 years, with a variety of people, a variety of workplaces. And mental health, it seems like it's just common sense to them. If they're physically sick, they'll tell you that they're sick. If they're mentally unwell, they will just tell you that, oh, mentally, I'm not so well today. I'm just going to take a day off. I remember one of my cases in child protection, very challenging job. I had a difficult case, something didn't go quite well. And my manager, my boss at the time told me, you can take as long as you want to rest and recover, and she actually called me every day to check on me, to talk to me and process my emotions. Coming back to Singapore, when I came back, obviously I had to readjust myself. So I got a little bit of a shock because everyone, especially in the workplace and even the community, there's this stigma, around mental health. If I tell you that I have depression, if I tell you that I have anxiety or stress, it's almost like people are going to judge me. People are going to think that I'm crazy. I can't open up. I don't know what's going to happen. So there's so much barriers, in Singapore. And yes, many people are not aware that they have a problem. Now, having said that, those who work in a private settings, in a private clinic, the clients or patients who reach out to them are usually more aware and they have the means to access help, to pay for it financially, right? What happens to those who don't? Right? They're usually not aware. And I know there's a study in Singapore in 2010, and it shows a very huge treatment gap, for those who are diagnosed with a mental health disorder, and the percentage of them actually seeking help. Well, I can't remember the numbers at the top of my head, but there's a very low percentage of people actually seeking help. And there's another study in 2018, same study, but 8 years gap, but there's not much increase in the percentage of people seeking help. So again, there's a lot of a lack of awareness, and even if you have some awareness, people just don't know where to go, right? Which is the right place, am I going to be rejected, is it safe, is it credible? So there's still a lot of unknowns, in Singapore, so to speak. And of course, when we look at the symptoms, sometimes we are not aware. But the people around us are aware, especially our significant others. So people might tell you that, oh, you get a little bit frustrated easily, you get a little bit more agitated easily, you get a little bit more angry easily, you seem a bit not able to concentrate or focus. So all these are really telltale signs, that just you may be suffering from something more serious. And then, of course, when we look at the lifestyle factors, those people who have, are starting to show some mental health symptoms, they don't sleep well, they don't eat well, they stop their social interaction. So all these are very, very important signs to pick up. And we hope to be able to train these people to pick up these signs. Because, I mean, to be honest, there are not enough psychologists in Singapore. I think the ratio is very low. I can't remember at the top of my head. One of the lowest in Asia, considering that we are such an advanced country. So we can never train enough psychologists or counselors or other mental health professionals in such a short time. So we have to empower other people to be able to pick up these symptoms, and we can also empower the person themselves to do something about it. Now, not everyone needs to go to the doctor when they're sick. So not everyone needs to go to the psychologist when they're not well. So for these people, maybe we can provide them with some self-help resources so that they can help themselves. So this is how I say it.
That's really interesting. If I can add a little bit to what you said, that's fascinating. Just from my own experience in working with some of the different corporates and organizations, I think what you say is true, where people are lost and confused as to where to access help, or and can I afford this help that I access? And then there's worries about privacy and worry about anonymity and worry about job security and things like that. The other thing that I found, and it will be interesting to hear what everyone on our panel thinks, but I've also we've also found that there are a lot of people that I'm confused about the intensity of the issue, where people feel only if I have reached a very exhaustive end, a very late stage, I'm feeling excessively down, it's affecting my sleep and my family, therefore now I should start the process of reaching out. We found that maybe because of a lack of understanding and awareness around this stigma of mental health as well, where there is no simple way for someone to understand my state of mind, my brain health, my mental health, and also the ability to say, well, my hand up, I think I'd like a little bit of help. I'd like maybe some self-help. I'd like maybe half an hour conversation, not a 2-hour conversation. To let people know that that's okay, I find it's something very interesting that's happening in the world.
Yes. So it's almost like giving yourself permission to be a human being, giving yourself permission to seek help, giving yourself permission to not do everything perfect and not to fix everything and not to please everybody. So this is so important.
Yeah, I totally agree. And I think to add on to what Chad was saying about the numbers, I do remember some of the numbers. I think the 2010 study says that 1 in 8 Singaporeans in their adult life actually have certain form of psychological disorder. And the 2016 one shows that 1 in 7 Singaporeans actually experience a sort of like OCD or depression in their life, and only I think about more than 75% of people who is having this kind of issue never seek any kind of help. So like not even consulting their maybe spiritual leader or their family, nothing, no kind of help. So only less than 25% of them actually, talk to someone or seeking professional help. So like Chad was saying, there's really a huge gap in the treatment seeking process. Yeah.
I'd like to ask Angeline Teo, as a corporate high flyer, what's your experience with this issue?
I think it depends a lot on the kind of companies you work in. I'm lucky enough to have worked in quite a few global corporations, from Sony to Time Warner to EMI in the earlier days. While there are Western corporations, the Asian offices are culturally very different. So while, as Chad mentioned, Australia, New Zealand, they're very open to mental health. They recognize the need for a day off. And the Asian offices of global corporations, they're still very old school. There's a lot of cultural differences. I used to live in Hong Kong for 10 years. And as you know, Hong Kong is a very stressful place. But a lot of the guys running the office, the MD to the regional head, they are mostly Asians. For them, mental health, as Chad mentioned, kind of equates that you're crazy. You don't need help. You just need to, fix it yourself. So that is very difficult for me. But I was also very lucky. I had a boss who was Australian, and he was very open about it. I think it's important to understand that even as an employee or as a boss, that you become supportive, and you also come out clean that you do need help. because you lead by example, and my boss led by example, so I was very lucky. He actually shared with me, oh yeah, I broke down a few months ago, I'm seeking help. You know, if you need help, I can, you know, I'll give you a few days off, I'll try and help you any way I can. So his support actually helped me to become more aware of what I needed. I was close to breakdown. And because of that experience and being able to seek help and take a week off to go for a retreat, I actually came back better and able to help my team as they navigate the stresses of work. So I think it's a lot has to do with cultural differences, as Chad mentioned, accessibility to help. And most importantly, really is we need to learn to be self-aware. And that's a skill that someone has to teach you. You don't just learn it out of the blue. So, you know, it's important for us to openly share about mental well-being.
I think that's a good point. In my practice, I see corporate people, including high-flying corporate people, turning up with unusual symptoms that they've gone for so many tests and they're all negative. Example would be very frequent headaches. The tests and scans are all normal, or episodes of giddiness that no one can figure out. The cardiology colleagues of mine also have patients who come in with palpitations, you know, so, or they have difficult in breathing episodes. These are all what we call the psychosomatic manifestations of mental health problems. And particularly in Asian cultures, you know, Singapore is a global city. It's a microcosm of Asia and the world, because we have people from all over the world living and working in Singapore. And it's quite interesting that it includes in my practice, my observation that both Asians and Caucasians all can have mental health problems and sometimes not know about it. And that's why I think some newer systems are needed to help people recognize it. Some education is needed to help people recognize it. I don't know, Effie, what do you think about mental health education for corporates?
And yes, I think I totally agree, because I do realize, because we spend a lot of time in our work life, like almost half, I think, and a lot of time how we deal with our work, how we handle our relationship with our colleagues, our supervisor, and basically the whole environment, the interaction we have with our workplace is so important. And we cannot avoid stress and all these issues. So I think it's very, very important for people to learn and acknowledge how they feel, and also learn maybe how they can actually handle this. It's, I think nowadays, some people might actually realize that they have some kind of stress or problem, and because it's kind of negative, so people trying to suppress it or even avoid it and not talk about it. But it's actually very important to acknowledge it. I think Chad will agree with that, to acknowledge it, and actually then you can start to, you know, regulate or handle it better. And it's like what Angeline was saying, like it's important for us to actually talk about it also, so that people accept it. It become a common sense somehow. So it's easier for people to seek help, because it's such a common thing. So it's okay for me to seek help. I won't need to be scared that people will label me or think that I'm crazy. So I think education is a very important step in actually helping people in any kind of setting, not only just workplace.
Prem, I think you're muted.
Now, do you have a viewpoint on employers who feel mental health is a personal issue for the employee? So long as he turns up, does his job, I'm okay with it. What are your thoughts on that?
This is, I would very honestly say, this has been the traditional methodology or way of thought in a lot of our Asian corporates. Although I see this changing ever so slightly, but very happy to have seen this change happen, especially in this year. I think I also could add to a little bit of what we had just discussing previously, you know, creating a understanding or a safety in talking about mental health in the workplace. From my point of view, working with corporates is arming them with information, objective information. I find it very, very important. So the ability to help evaluate, and then understand mental health issues within the corporation helps employers then to create a tangible understanding. And from that tangible understanding is to then to destigmatize that issue and to create an environment of safety. I have had employers speaking to me, organizations speaking to me a lot about how do we create a safe space for mental health in our firm. The first step is to first understand and look at what the data is saying. Let's look at objective data that tells us exactly what's happening on the ground. And secondly, and which is I think very important when we talk about taboos and stigma around mental health, it's very easy to fall in the trap of thinking, well, I am embarrassed to talk about it. But there is another layer of depth or dimension to that understanding of that taboo. The other layer is my data might be used against me, against maybe my promotion, against my job security even, and it may not affect me today. What about next year? This feeling is all the way from my army days when I've had army buddies, feeling the duress of mental health and saying, no, please don't tell anyone. This docket is going to follow me until I retire one day. It's a very scary notion to think about. So in discussing mental health, especially in the corporate workplace, it's also very important to mention where data like this has to be treated like medical data to the highest level of compliancy that we would apply to any sort of medical data. That understanding that sharing of information about how anonymous this information is owned by you actually helps employees and individuals within the corporates to feel and then access the value of this information more. So we always find it very important to talk about the data security, the data compliance, that firms like us really want to go the extra mile to ensure that we are utilizing these processes, if not more. I think the second thing, if I could talk about since we talked about the dimension of mental health in terms of the security of information, another thing that employees are starting very quickly to understand is the comparison of the juxtaposition of absenteeism and presenteeism. It's actually looking at building an ROI, a tangible ROI at mental health. How can it affect me? It's not just a tick box anymore within a firm. It's not just, hey, I have an EAP provider, which by the way is 3% engagement rate globally. 3%. It's shocking. The number is shocking to me. So instead of having a tick box, employers and organizations are starting to understand and say, well, mental health, understanding the mental health of my employees, my most important asset, and then helping to improve that value, creating a place that is safe for people to flourish, to nourish. I am going to do better. My productivity is going to increase. My efficiency is going to increase. So in a very long-winded way, Dr. Prem, I'll go back to the main question. Employers, especially in a very remote, fragmented workforce, which we will see more of, especially towards the next decade, you have employees working from all over the world, if not even all over the country. So absenteeism, when it used to be rife in the past, is lesser now. People are at the workplace. It's easy. I might not even need to commute. I'll be at my desk at home comfortable. I'll get my laptop on and I can work. So the most sinister problem will start to rear its head, and that's presenteeism. So just for the purpose of sharing, I'll go into a basic definition of presenteeism. So while absenteeism is a very clear understanding, I am not at work, I'm absent. Presenteeism is what happens when employees under duress, under mental stress, are physically present at work, but mentally not there. We call this problem, the slang is the zombie worker. It's a very scary problem. It's very hard to evaluate it. It's very hard to put a tangible number on it. But when you start looking at your numbers at the end of the year, you'll panic. Everyone is here the whole year. Everyone's been attending. How come we're doing worse this year than we did last year? What's going on? And that's one of the serious ill effects of mental health that employers and organizations are starting to value, they're starting to understand, and they're starting to build an ROI around it. I think these factors in combination add a lot of power and a lot of effect into creating these systems in a very confident way in the workplace.
Chad, do you have anything to add to that?
Yeah. Very interesting and very important points that Nav has raised. Now, I just want to kind of point out that very interestingly, companies so far have a lot of ways to measure, productivity, to measure outcomes, especially in dollars and cents. But then a lot of companies don't have a way to help measure someone's or employees' mental health status. So there's this huge lack of data, like Nav mentioned. So we need to get objective data, which is so important to monitor, employees' mental health on the long run. And I think the other thing is, presenteeism. As you know, some organizations, they have employees, they're forced to go to work, but they have nothing to do, for the whole day, or even forced to go to work on Saturday. I have people telling me that they will literally just stare at the screen, right? So I think with a lot of objective data, we can ask ourselves many questions. Is the intervention going to work? If it doesn't work, why doesn't it work? How can we move forward? How can we better improve things? Of course, with all this, we need objective data. Very important, and this is what is missing in a lot of the Singaporean companies.
Angeline, can I ask you, what are your thoughts about what could have been, done, or what can be done better in the corporate workplace for employees?
I think first and foremost is the culture, the corporate culture, and what they stand for. That is not solely about the ROI, but they care about their employees. I think just showing that you care about their well-being, whether it's physical or mental, as a company, and the goal of the company, as Chad and Nav has mentioned, is very important. Because sometimes these employees just want to feel valued, they want to feel cared for, right? I mean, you spend so many hours at the office, but if the company only cares about your output but not how you are outside of work, I think you will lose interest in your job, and then you won't be as present at the job. So I think having a good corporate culture is a backbone for good mental health. And I think secondly is really about educating your leaders. I think it comes from the top. If your CEOs and your MDs and your CFOs all understand that mental health and mental well-being has an impact on not just productivity, but the company culture, how the company looks in the outside world, and also how the employees feel, and they value that, then, and they themselves are open about it and able to be vulnerable to, I think it would help with, the employees to actually seek help when they need to. So I do think it's very important that it starts from the top.
Yes, I totally agree, Angeline, because when we are doing trainings for corporate, we actually do recommend, for example, we have a lot of questions asking, how can I help my employee? How I can help my team? And a lot of people will attend their leaders. So one of the main recommendations we give them is actually to open up to a team about your own struggles. Sometimes might actually help, because once you open up your set up the floor or the space, a safe space for them to share. And from there, you can have more communication going on. And once the communication and rapport has been built, and then it's easier for you to provide help. It's always about them to start to do things that they're about to say. So it's really like what you are saying, really coming from the top, like CFOs, CEOs, and even team leaders. So once they start, it's much easier. And I do have feedback from people who say that it actually work. They agree that it's a good way to help their team, actually.
If I might just add on, I mean, based on experience, I had a team. So, and for me, when it's time to do yearly reviews, where you decide they can get promoted, my concern was really, do you enjoy working here? That was my main concern. Do you want to come to work every day? Are you joyful? Are you looking forward? Because if you're not, then I need to find out why. I need to find out why you're not motivated anymore. Is it you're having family problems? What else outside of work? Or is it the work environment or the work itself? So I think it's important that when companies do review for their staff, that they don't just review the very practical, ROI-driven points, but also understand if this person really enjoys doing what they do, and if not, why. How can I make job more enjoyable for them, and so that they enjoy coming and be more present.
That's a really interesting point. I think you must have been a great boss, Angeline. That's not
I learned it from my boss, so thankfully.
Always happy to hear when someone in the corporate world practices that. That's really fantastic. To add on to that, some of the things that from employees that we've worked with that I've heard, there is like a bit of a fear in sharing these things sometimes face to face, you know, like if you were to be asked and go, well, you know, how do you feel like this past year? Was it? Yes, it was great. I had the best time. I'm very happy. You know, where secretly you hide some of these things that are difficult for you to say. I guess it's a very Asian-centric notion where you feel, okay, I'm outstanding. Everything is okay, you know. And we find that this is the little bit of the trepidation that you know, for some people that it feeds the stigma, and then they worry about how can I share that something is wrong? What's the safe space? And you know, even we do some mental health ambassador training, we call it, with some of the companies, and we work with managers, we work with senior leaders at trying to be even more upstream. And so we say, and more often than not, when a company has, exactly like you mentioned, that safe space to talk and discuss and be honest is a very, very big portion of it, then giving an olive branch usually helps amplify that value. So when we speak to these managers and we train them, like Effie mentioned, we try and look at signs of symptoms even before your employee shares with you, you know, like little minuscule data points. And now that we work in such remote settings, even to be in a Zoom call and try and understand someone's body language is a bit different, the reaction to certain things are a bit different, and then to reach out privately and say, hey, Angeline, I don't know if everything's okay, are you having a good week? And just a very non-judgmental, simple way of asking a question on an olive branch. And we find that people actually accept that. You know, they might not go into a lot of detail, but it might say, well, actually had a lot on my head and a lot of difficulty, and then we can try and offer them more help. So I think that's wonderful to hear from you, Angeline. But you know, I think as we move ahead, we'll start to see a lot more of these upstream values where our leaders in the business are able to be trained to pick out situations even before the employee, or even before there's a appointment for an employee to chat with you. It becomes just part of our workday, and how we ask our colleagues, have you had lunch? You know, I might say, hey, Chad, you seem a bit down. Everything okay? You know, where it becomes a normal conversation for us to have in the workplace.
Yeah, if you don't mind, I would like to add, I think starting from the top is not just about training them, it's also first understand if they are having mental health issues. Because if you are having issues yourself, how are you going to care for others? You can only give when you have too much to give. But when you yourself are suffering, or you're suffering from stigma, a lot of bosses have a lot of egos that they can't look weak, as you guys mentioned, and they need help first. So I think they need to be open to first seeking help, being able to resolve their own issues before they can help others. Because I don't think it's also fair to expect a CEO or an MD or a CFO or a team leader who has their own issues to then be sensitive to everybody's issues. It's very hard. I couldn't do that at the beginning. I could only do it when I'm better myself.
Yes, I totally agree. It's almost like, I think a lot of time we use the oxygen mask theory. It's like they always tell you to wear your own mask before you help others. So it's really important for them to knowing how to manage their own problem and seeking for help before they can help others. And I think through the process of seeking help, they actually understand better how the journey is like. And that way they can be even maybe more empathetic in situation and learn how to be not judgmental or things like that in helping others. So I think it's a very important journey if they need help to.
Yeah, I couldn't agree more. I mean, if you go through the whole journey of seeking help yourself, you understand how you can recover and what people need to recover. And then you are able to help others.
Yeah, that's really interesting. I use myself as an example, you know, to become a better helper myself. So I went through quite a few months of therapy, you know. So I was experiencing myself as a client, you know, to walk the shoes, you know, and it just changes the relationship with my clients now, because the relationship becomes more equal, it becomes more authentic, it becomes more genuine. So when it comes to leaders, you know, when it comes to managers, so it's so important for them to walk the talk. You know, I've got a few leaders who say that, you know, oh, I can't connect, you know, with my employees. I feel very weird to ask them about their personal life. So it's better to just stick to work, you know, you do your job, you know, that kind of mentality. So education and creating the awareness is so important, because ultimately, I mean, let's face it, if you want a work-life balance, for example. If your boss is not going to leave the office, the employees are not going to leave the office. They will stay as long as the boss stays in the office. And how do you expect your employees to have a good work-life balance?
Yeah, and I also think it has to come genuinely, as you mentioned. You need to genuinely care about the people in your team. It can't be done just because you're trying to get ROI. Your employees can smell it.
Yes.
So I think it is important the authenticity is so important. And I learned it the hard way, right? I mean, at the beginning, when I first joined the company, I run the team like I run any team, ROI driven. But through experience and learning from other mentors, I realized when you care about someone, they're more involved in their work, and their output is more genuine and more passionate too. So I think while at the end you still get the ROI, the process is very different.
I think, Angeline, that's a very good point. I personally think that the C-suite leadership's KPIs also has to include some kind of KPI in relation to employee well-being. Yeah. It's not so now. But just like among countries, Bhutan actually doesn't just look at GDP, they look at a happiness index, which is quite interesting. And I think the next generation of leaders in forward-looking companies have to look also at metrics in relation to employee well-being. I think, Nav, you have some interesting ideas about metrics. Maybe you can share that, because that's important to scale, to be proactive rather than reactive. You want to know what's happening with your employees.
Yes, I think the current climate, or the more methodologies to think of mental health as or solutions around mental health, or even a very minimal understanding of matrix, but on a very touch point or very episodic level. If somebody needs access to some help, we have some help, or we might have a certain situation where we reach out to all our employees and we say, well, how's everybody feeling? And then that gets left. Okay, we have done that at the June meeting in the year. But looking at mental health longitudinally, allowing access for a long period of time, and then looking at the data from that is what allows companies to then drive policies, drives plans, make changes to current policies, and then look back at the longitudinal data and see if we've gotten to a better place than we were, and then that is the important one. Maybe it's a happiness index. So at Cognifyx, we look at, for example, cognitive scores as well as mental state scores. So we look at cognition because that's what affects our productivity at work. It makes us feel amazing to remember things, to be sharp, with our mind. And then we look at your behavioral health. We also look at mental health. And we use this combination of data in a longitudinal way. This has helped a lot of the companies we work with to then devise policy so that they can make improvement and changes for the employees, for the effect of the employee being a happier, more productive employee at the end of the day.
I think there is a comment on the webinar chat from someone from a big tech company, and his comment was, keeping it internal in corporates, mental health can be improved by being aware of unconscious bias in and around you. Be empathetic. Never judge unless you fully understand a person. Take efforts to understand again and again. Practice mindfulness above and overall. Put humanity above everything. Comments, guys? Unconscious bias.
That's so true. I don't know. I think in Singapore, many local companies, they're almost like run like army style, like very hierarchical. I know those Singaporean males who have been through army. So there's a lot of kind of like unconscious biasness they have, within themselves. They're not even aware of. I mean, they probably have been conditioned in the past to act or behave in a certain way, so they might not even know what's wrong.
I think you're right, Chad. When I see the word unconscious bias, I always think about subjective qualities in us understanding our mental health situation in the workplace. Someone has a certain sort of a feeling and an opinion, and suddenly if I amplify that enough, it becomes, this is what's going on. But very subjective. I think the key really is to look at this very objectively, to look at it objectively is to be able to measure it in a very safe and very clean, very clinical way.
Yes.
And use that as a measure of growth and a measure of success. I think that's a really good comment, because if you take unconscious bias out, it gives us the ability to put humanity above all others. And that's a very good way to end that comment, because end of the day, I think in any corporate we work with, I think your biggest asset are all your colleagues, your employees, you know, and their biggest asset is their mental health, their happiness, their brain. So it's quite
Yeah, I think which is why the corporate culture that's established from day one is important, because if the corporate culture is always about just ROI, and which a lot of financial companies we know are like that, you know, then that culture doesn't change. No matter what you do, is the people in there are just going to be led by that culture, where empathy is not important, is not viewed as an asset, you know, where you need to backstab each other to get to the top, where that kind of skills are more important than helping each other or teamwork, you know, or helping each other through projects. Yeah, it is very easy to say, but we do, I mean, as Chad mentioned, I have many friends who are stuck in local companies and they can't get out of it. And they can't even voice it out because there's just no way to voice it out. So I'm curious how we can help them, right? I would love the system to change a bit more.
There's another question here. How does a company really understand if their leaders have the empathy skills to lead? So I think this, of course, requires the company to want to take the first step to find, if they can't do it internally, usually you have to find a consultant to actually look at this for you. But any thoughts on this?
I think a lot of time, because we do, for my personal experience, when we do some trainings, we do actually provide trainings on how to help people to be a little bit more empathetic. Like the simplest thing to do is actually to learn how to listen. I think it's one of the first steps to actually listen to your people without any judgment, or like learn how to be just listen, to be a listener, like active listener, to be not a leader, but a listener. Because a lot of times, like Angeline was saying, it's important to share, and sometimes in order for someone to share, it's important for them to feel safe, and for someone to be on the other side, listen without any judgment and show it to whoever is speaking is very important. And I think it's actually a skill. It's not really something we can just acquire over there. Some people might be a bit gifted in that, but it's something that we can actually learn. And I think that's a first step to actually become more empathetic. And I think some company, they might have people who is already have that kind of skill set. And of course, we can actually still train people to become more empathetic, and especially with their leaders.
I think that when we look at some soft skills in the corporate world, especially when we talk about leaders, I think Dr. Prem mentioned before that the new generation, the forward-thinking leaders, you know, these are some of the important attributes that will say, well, I think that's the guy who'll get the promotion. That's a good leader, you know. But as we look at these soft skills, we must observe them in a spectrum. So they're not hard skills. It's not binary. So it's not I'm empathetic, I'm not empathetic. It's how empathetic am I? Then the second is what Angeline brought up, which is very true. Am I invested, involved, genuine, really want to help? I want to be more empathetic. I realize and recognize that as a value that will improve the way I can lead and work with my team. And I think that's important. So now I want to engage, and then I want to train more. So as we look at some of these soft skills for leadership, again, it's very good to look at it objectively and over time, and look at people or having individuals invested into that, genuinely invested into that idea, to be positioned as that, you know, the next wave of leadership.
I have another question here. And the question is, organizations talk about the right person for the right job. And if this can be done much better, a lot of the stress and mental well-being can also be addressed. There are psychometric tests for hiring, but not sure if they're really effective. Do you think there could be a better evaluation at the time of hiring itself through better psychometric tests, which in some way can map the mental aspects of the individual to do the job?
I think that's a good question. There are definitely better ways at looking at using psychometrics. We call it neurometrics also, because we want to include some of the soft skills that I think that I just mentioned as well. In doing so, it's about building a closer relationship with the partner companies that you would work with, because it's important to understand the job, the qualities and skills, both soft skills and hard skills needed for the roles. Second, to then understand, very, very importantly, for very forward-thinking companies to understand, again, the lay of the land objectively. Let's look at other individuals within that particular job scope or job type, be it in different regional areas as well. Let's objectively look at how they are performing and how does the company think their performance is from a hard skill and a soft skill point of view. And matching these processes to better psychometrics, easier psychometrics, it's a simpler way at understanding at the hiring level. But I also think it's important not to end at the hiring level, to actually follow through towards an employee's life cycle or an employee journey, to look at information like this at point of conversations, Angeline, like you had mentioned, appraisals, at times of appraisals, at times of growth, or even at times of duress. So these pieces of information, we can't think about it as episodic or hard stop moments. They can follow us through our employee life cycle and journey. The psychometrics and the analytics of the data behind it become all the more powerful as the longevity is grown.
Yeah.
To be clear, I think Nav, because particularly in the corporate world, at the C-levels, they are quite familiar with psychometrics. But I think what you are talking about is digital psychometrics, whereas they are used to pen and paper psychometrics, interview-based psychometrics. Many people, I think, are not aware there is a new digital world in neurometrics and psychometrics, which can pick up a lot more information on that person, including behavioral traits that may also feed into empathy. So that could also be a key hiring marker for companies, not just someone who's a domain expert or a great business leader, but there's no empathy, for example, right? Which it seems that many people in the audience also are resonating with. Is that correct, Nav?
Yes, it's exactly it. A digital brain scan to understand better.
Chad, is there anything else you want to add to this?
Yeah, just picking up a little bit on what Nav said just now. The hiring process is really just the first step of an employee's journey. So we want to be able to support the employee, throughout, their whole time in the company. Like what Angeline said before, how do we make sure that the employee stays engaged, stays satisfied, or even stays talented? So we need, the digital tools to be able to inform us, how we can better support, the employees. And of course, the pen and paper we know that it's a very traditional way, it's less effective and it's very time consuming. So we are moving to the digital age whereby we can really harness, the technology and the power to do a lot of useful things for us.
So I think we have a last question here. We're running out of time. What do you think will change in 2021 in terms of the relationship between employer and employee? Perhaps I can reword it. What do you think should change? Not that we want things to change, because we realize that current systems are broken. EAP, which is employee assistance programs, are mostly dysfunctional and not used by most people in the company, and many people don't even know where the hotline for EAP exists. As many of you know, and I worry sometimes that HR just wants to provide band-aid, so they tick a box, as they say, and just covered up the problem as far as superiors are concerned. So I want everyone to have a viewpoint as we end this panel. Chad, do you want to go first?
Yeah. I think we know that many things need to change, and I think having a conversation, is really important. I think everybody needs to take the first step, and everybody needs to know that we all have autonomy, and we all have some kind of control, and we can make our own choices. Right. So, for example, if you're not being treated fairly, in an organization, so find some ways to speak out, seek help, have a conversation around, somebody that you're close with. That should be the first step. Otherwise, we may just fall into the victim mode. Oh, I'm helpless. There's nothing I can do. Things are just going to be like that. So maybe it's the way we look at ourselves as well. Maybe it's the way we present ourselves. Are we thinking that we're just a victim, forever? Or are we able to take the first step, just to have a conversation with someone that you can trust? So again, it's the connection with the people that's really important, building that meaningful relationship.
Effie?
Yeah, I totally agree on what Chad was saying on this. And I also think it's very important for both employer and employee to acknowledge the importance of mental health. Like only when you have your like what Angeline was saying, only when your employees are happy and enjoying their job, then they can be more engaged and less, be more present. So they're not being having too much presenteeism at work. Yeah.
Angeline?
I think my take is more, how can companies have employee welfare that doesn't sit within HR? At the moment, I think a lot of it sits in HR, and I think it should be an independent, confidential team that reports directly to the CEO, that would be objective. You hire the right people to run employee welfare. You can hire a psychologist to be a part of it, and make sure that companies actually take employee welfare that's separate from HR. The current structure clearly does not work. HR is there about hiring, firing, reviews. It has nothing to do with employee welfare. All they care about is, do I have the right people to do the job? So I think that has to change. I hope more and more companies will start looking into employee welfare as a standalone, independent team that truly has people who are empathetic, people who understand the space and can change, has the power to change because they are part of the CEO's office. That for me is just something practical that I think would help.
Nav?
I mirror Angeline, your sentiment. I think that's would be in the how the world should change, the corporate world should change moving on. I think that in the next years coming up, 2021 and ahead, this next decade, while it may seem that the world is getting smaller, we have a lot more virtual working environments. In fact, we're getting bigger. People are going to be further apart. The small office where you sit next to 4 or 5 people is going to be lesser and lesser, and that's very important for corporates to look at and think about mental health, employee welfare and well-being in very remote work settings or virtual work settings, but also to utilize this information in objective ways to offer continuous and longitudinal support using data like this, planning intervention and policies that can be directed towards employees more easily, rather than offering one-stop group solutions where everybody gets an app, everybody has access to this one tool. All right, you're fine. I think it's time when we will stop ticking the checkbox and actually start caring for the people that we work with. I think where inclusivity and diversity was the last 10 years, that was the HR mantra. Hopefully, like what Angeline said, we have new silos reporting into CEO where happiness and productivity become the new term. I'm happy at where I am and I love that I'm doing great at work. That would be a great world to live in.
I think that's great. I'd like to thank all of you for being here to discuss these kinds of issues in mental health, and look forward to better solutions for mental health, because it's really needed, particularly in the corporate workplace. Thank you all
Thank you
for being here.
Thank you very much.
Thank you.